National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Jonathan Beatty here, naturopathic doctor and a health expert at nationalnutrition.ca. Today, I want to explain a little bit about ear infections and some of the things you can do to help treat them and prevent them. Ear infections can affect the outer ear, the middle ear, or the inner ear. They're typically known as otitis externa, otitis media, and otitis interna, referring to, again, the outer, the middle, and the inner ear. Symptoms of each are going to be a little bit different. When you have otitis externa, typically you're going to see, redness of the ear itself, redness of like the outside of the ear, redness or itching inside the canal, sometimes pain inside the ear canal. Now, when you get otitis media, that's inflammation of the middle ear, and that's often a very painful type of ear infection. Typically, that's the most common type in children. That's the one you see commonly occurring between the ages of 3 months and 3 years. Part of the reason for this is structurally the ears change as we age. And when we're very young, our inner ears or our middle ears are very flat. And what happens with that is it's very hard for an infection to drain. As we age, the canals actually start to dip down and they actually start to aim down. So it makes it much easier for an infection to drain downwards, and that makes it much less likely for an infection to occur. So when you have that otitis media, it's very, very common in children. Now, if that gets out of hand and out of control, it can sometimes affect the inner ear. Now, the inner ear is not really used for hearing, it's actually used for balance. So it typically doesn't disrupt hearing as much. So when you have otitis interna, it can cause nausea because when your body doesn't feel stable, one of the symptoms of that can be nausea for a lot of people. So if you have a child who's got an ear infection and all of a sudden they start to appear dizzy, they start to maybe complain of nausea, that's often because the infection's getting worse and now starting to affect the inner ear. One of the major causes I see in my practice of chronic recurrent ear infections are twofold. One, weirdly enough, are antibiotics. There's actually been multiple studies done that show the earlier you give a child with an ear infection an antibiotic, the more likely they are to have a severe infection and the more likely they are to get a recurrent infection. So the more likely that infection is going to show up again later in that child's life. Typically what you're best to do is actually try and leave the infection, let it heal on its own for a couple days, and only if it becomes a persistent infection should you then go and get the antibiotics to treat it. Now, there's a couple of treatments you can try in advance of doing antibiotics, and this is typically what I recommend for my patients. One of the easiest is actually just to put warmth over the ear. Taking a hot water bottle, filling it up and placing it over the ear, the warmth can actually cause the eustachian tube to expand, allowing the infection to drain, reducing the pressure and reducing the discomfort that the child experiences. If you really want to kick this up a notch, you can actually make something called an onion poultice, where essentially you chop an onion in half, you warm it up in a little bit of oil, make sure that it's not so hot that it could burn the skin, because you're now going to then wrap it in cheesecloth and place that over the ear. And onion has something called a sulfur compound in it, and those sulfur compounds actually get into the ear and are actually antibiotics. So they'll kill that infection off as it's affecting the ear. So it's one way that you can actually diffuse the antibiotic in through the eardrum to deal with the infection. Another way to do that is actually to create ear oil. So you can actually buy commercial preparations of ear oils, or what you can do is make it simply at home by crushing up a clove of garlic, putting in about 2 ounces of oil, leaving that overnight, and then you take that oil, which you'll now notice smells very strongly of garlic, and place 1 or 2 drops of that in the affected ear a couple of times a day. Garlic itself is a very potent antibiotic, and this allows the garlic oil to diffuse through the eardrum and again directly applying the antibiotic right onto the infection. Much better for treating chronic ear infections. Another reason I often see people have chronic ear infections is related to a dairy sensitivity. So children that often have dairy sensitivities, they don't always manifest as a digestive concern, and many times they can actually manifest as chronic ear infections or chronic throat infections. The two are often related. So if somebody has recurrent tonsillitis, it's often associated with recurrent ear infections because the same bacteria is involved. Part of the reason a dairy sensitivity is the problem is it creates inflammation of the oropharynx and of the ear, and that then allows the infection to move in. As well, dairy is considered very mucogenic, so it causes a lot of excessive mucus to be produced. This blocks the ear canal, causing pressure to build up behind the eardrum, and that's what actually causes the pain. It's a pressure buildup as the infection grows behind the eardrum and can't be drained down the eustachian tube. So reducing dairy intake can actually help to manage an acute infection, and also eliminating dairy from the diet for susceptible children can actually help prevent the recurrent ear infections. Now, if you have had antibiotic treatment for an ear infection, one of the things you're going to need to do is replace the lost good bacteria with a good probiotic. Typically, I recommend a probiotic that's got something called Salivarius Bliss K12. The reason for this is the type of bacteria that's been identified to actually kill the type of bacteria that causes ear infections. So Streptococcus pyogenes causes the problem. Streptococcus salivarius is its arch nemesis and can actually help heal and kill the pathogenic bacteria that leads to the ear infection. So supplementing with Streptococcus salivarius, specifically in the oral mucosa, so in the mouth, in the nose, that's one way that you can get it, because it's going to travel through your mouth, through your nose, and up into the ear, and that's actually going to protect against recurrent ear infections. As well, you can also use some antibiotic herbs to try and help treat ear infections. Things like golden seal are found to be very effective, as well as, again, stimulating the immune system with vitamin C and zinc. Vitamin C and zinc have been shown to help tissues heal and repair, but they're also necessary for the immune system to function properly, to help, again, eliminate the inflammation, eliminate the infection, and make the ear infections go away. So I hope you've learned something very useful for yourself about ear infections today. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And remember, knowledge is health.